Okay, so I'm going to look for the green button first. So it's the one right here that's green. Okay, I got it. Okay, good morning. And I'm Alice Kerber. I'm an advanced practice nurse in oncology and genetics, and I am so honored and proud to be representing Georgia and the Cancer Patient Navigators of Georgia. As I listened to this panel, and we talked last night, and we talked over time about being here, I'm a navigator myself, and I have been since before navigation was cool, and just have been called a lot of things in my life, including all the names that Darcy listed on her little panel. And in fact, when we were beginning Cancer Patient Navigators years ago, I wasn't working with them yet. Angie Patterson and Karen Beard came out to my hospital to talk about navigation. Well, I'm a navigator, right? I knew I was a navigator. People were supposed to know I was a navigator. So we're speaking to a support group of oncology patients, all of whom knew me. And so I have Karen and Angie up at the front talking about patient navigators, and they said, oh, we don't have those here. And I said, wait a minute, what am I right here? And they go, oh, no, you're not our navigator. You're the one who helps us. Okay, so maybe there was need for a little bit of education here. But I think that what's good today and what we've seen in the last, now you go back to, what was it, 1993 or 20 years ago, that we're beginning to actually understand what this term is, and we're using it a little bit more. So all that said, Cancer Patient Navigators of Georgia, and I will use the green button to see if I've got, you have to push hard. Okay, is there a way? Okay, I'm telling you. Is it this one? This one. That's green too. No wonder I couldn't find it. Okay, sorry about that. Thank you very much. I needed a navigator, to help me through this, right? Okay, so Cancer Patient Navigators of Georgia, we are a statewide virtual organization, and we try to reflect the diversity not only of our population, but also of the population of navigators that we have. We have a shared mission to educate, identify best practices, always reducing barriers, and then, of course, increasing access. And if you look at my map, and Angie, I hope I made the map fat enough, because when she was looking at this slide last week, she said I made Georgia too skinny. So I'm doing the best I can here. So Georgia, just to tell you a little bit about us, we have 159 counties. And the ones that are identified as rural, we have at least 100 identified as rural. Majority of our population, we have 10 million population in the state, 5 million of which is right in the Atlanta area. Is there a pointer that I could do? If you look at where most of the yellow is, that's Atlanta, okay? And then there's the rest of the state that we have navigators around the state, but not as many as certainly we have focused in the Atlanta area. Let me just be able to read this. Okay, you can see that we do have diverse navigators. We have a majority of nurses, certainly, but we do have physicians. We have public health workers. We also have dietitians, nutritionists that I didn't list on here, but they are on there as well. And so we try to be very collaborative, very interactive, and provide support to everybody. We're sort of the navigator for navigators in terms of what Georgia Core is. Georgia Core is a nonprofit, Georgia Center for Oncology Research and Education, and that's who I work for now. So they got me away from the hospital where they didn't know I was a navigator, and now hopefully they do know I'm a navigator. Okay, I think that's all I wanted to do with that slide. Okay, push hard. All right, there we go. Okay, so when we were first starting this in 2008, we had Harold Freeman come and chat with us, and we did do a survey of anyone who identified themselves as a patient navigator around the state. Of those 80 respondents, you can see we had a majority of people that were paid. So we were looking to see if they were paid by a hospital or a health system or a community outreach, whatever it was, or if they were church-based or faith-based or just walked off the street to help people or whatever it was. We had a variety of people that were, most were paid. Again, we go back to breast was there because breast is very common and a majority of people were breast cancer specialty. That has changed over the time now. We do have navigators in every site. We have navigators for leukemia and lymphoma. We have navigators for lung. We have, in fact, one of the projects that's going on in one of the community hospitals is following up on incidental findings. So Ray's comment before about how complicated lung cancer is certainly something there. I was a lung navigator too for a while, and it's complicated because you never know where they're coming from or what we're going to be able to help them with, or all the guilt that they carry along no matter what's coming along with them. They had 100% interest in having some sort of organization that would help them all meet together and feel like they weren't out there alone. Because remember, I showed you the map where a majority tend to be right around Atlanta. We have all these navigators around the state that don't necessarily have the supports and resources that they could have. And what we were trying to do with this organization was promote that collaboration and efforts. Okay. Push it hard. Here we go again. There we go. Okay. So how do we maintain this with Statewide Communications? We do have a newsletter that we send out to all of our members. We have about 350, 400 members now. We started with that initial 80. We have current board, if you will, board of 4. We do have 2 nurse navigators. We have support from administration, which would be Georgia Corps. Also, the Georgia Society of Clinical Oncology also helps to support us. And we try to rotate through the people who might be part of that resource group to make sure that we're addressing needs of community health workers, promotoras, of, again, dietitians, educators, whoever we have. We want to make sure we're collaborative and interactive. We do have a website that we provide members only on there, and so they can connect with people if they want to talk about what's their specific problem. Moving forward, always, we want to provide something else. Because we find that we now have an annual conference. We all come together. It's great. Everybody's charged up, and they go away. They're all charged up to go, and then time passes. Okay? So it's now we're to a place where what can we do to fill in that time, to make it more than just once a year. So we're looking at having specific quarterly events or having something else where they can easily write to us using the technology like we talked about in the previous session. Okay. So once again, we are part of, listed as Georgia's Comprehensive Cancer Control Plan in terms of navigation. We have a specific expanded role for patient navigation that's been put in I believe it's the 2014 to 2019 Cancer Control Plan. We have participation on a variety of the working groups. I personally am on the early detection and screening group, and we have subsets of lung cancer screening and colorectal screening, and we've worked a lot with Elizabeth and CDC on a variety of our projects. We are an inclusive organization. Our mission was not just to be nurse navigators, not just to say they're the only ones, because as has been said here many times already today, it's a relay, it's interactive, it comes and goes. We need everybody out there. I remember as a nurse in the hospital, I always wondered why patients spilled their guts to the housekeepers, right? Because you'd say, just talk to me. I'm in and out of here all the time. And they'd go, you have a sharp object in your hand. And the housekeepers are the ones that are doing normal stuff. So sometimes you just want to talk to somebody who's doing normal stuff and is someone that you can relate to. We've heard that many times, whether it's in terms of what you do, your financial capabilities, or whatever. Okay. So just to mention real quickly, because I have about a minute left, just to say this is in many ways the faces of the navigators around the state. We are all connected. We try to stay connected. When we have our annual program, we try to do, this last one we had in September had metrics. We've had other times where we focused on integrative therapies, because we've had some training in integrative therapies, and we've done some work with a variety of navigators around the state. So we do have promotoras, I mentioned, and these are lay navigators, community health workers that work in the northern part of the state, where our population there is primarily Hispanic and often undocumented, and are often people that would otherwise resist going to any kind of care. One of our navigators has a van that she fills with food, supplies, and all those kind of things. So she goes to people's homes, gets them to their appointments, and makes sure they have whatever it is they need. Each of these navigators, anyone I ever talk about, they meet the person where they are. We've said that many times already today. Meet them where they are, find out what are the barriers we need to help work against, and then go from there. We also have, as you saw earlier, with our survivors that were here this morning. Often some of our best navigators are the clients and patients themselves and their families, and working together to help us determine what it is we need to do. I want to mention one other friend of mine, Wanda, who is a navigator in one of our more rural areas, and she is the navigator to all people. It depends on wherever they are. It's a community hospital, but she also works with in a physician's office and in community centers, and she puts on Pink of the Day events and all those things in October. So she does everything. So sometimes we have navigators that are literally there as support for everyone, as we've heard also, and some are more focused. The other role that I have is in working with Department of Public Health. I know I'm a little over, but I'm almost done. Because I wanted to mention this because of our Colorado friend, just to say that another thing that's going on is identifying, once again, we're back to breast and ovarian cancer, but I work as a genetics nurse identifying women at risk for breast and ovarian cancer in the public health departments around the state. We have 159 counties, and we have the program in 126 out of those 159 counties. And what we do is the nurses work with me, and we do our little relay thing to make sure they get whatever it is they need. If they're identified as high risk, we make sure that they get to mammogram. If they are identified at high risk, I do counseling with them, and we find that they need testing. I help find the resources. That's part of the whole thing. We all work together to find the resources for what people need wherever they are around the state, and I appreciate your time. Thank you very much.